emotions ever feel like they take over, like they come on too strong, too fast, or they stay longer than you want them to? Maybe you've tried to calm yourself down, but in the moment, nothing seems to work. You're not alone. And more importantly, nothing is wrong with you. Your brain may be simply wired right now in a way that makes emotional regulation harder. The good news is that can change. We're going to talk about how using dialectical behavioral therapy, or DBT, with neurofeedback can help you regain control and build a more balanced emotional life. Emotional dysregulation affects all of our lives, and it's more than just having strong feelings when its emotions feel overwhelming, hard to manage, or to slow down and settle down. This isn't just psychological, it's also neurological. Parts of the brain responsible for emotional reactions can become overactive, while the areas that help you regulate and think things through may not engage as efficiently as in those moments. That's why simply trying harder to stay calm often doesn't work. We need approaches that support both the mind and the brain. DBT is built on a balance of two things: acceptance, acknowledging your current experience without judgment; change, learning skills to improve your responses and your behaviors. DBT is designed to give you practical tools to manage intense emotions. It focuses on 4 skills. First, mindfulness, learning to be present in the moment, observing thoughts and feelings without reacting immediately, creating a pause between emotion and reaction. Distress tolerance, giving strategies to get you through the intense emotional moments without making things worse, using self-soothing exercises and grounding techniques like deep breathing, and distract yourself from impulsive behavior. Emotional regulation helps you understand and shift emotional patterns. Starts with identifying what you're feeling, stabilizing care of sleep and nutrition. This reduces emotional vulnerability. Interpersonal effectiveness is the third, knowing how to improve your communication and navigate relationships more effectively. Learning to ask for what you need, set boundaries, and balance self-respect with relationships. These skills give you a roadmap, what to do when emotions rise and how to respond in a way that aligns with who you want to be. Neurofeedback works directly with your brain. It's a type of training that helps your brain learn how to regulate itself more efficiently. During sessions, your brain activity is monitored in real time, and you receive feedback that helps guide your brain towards calmer, more balanced patterns. Over time, this can help reduce that constant sense of being on edge, improve your ability to focus and stay present, create a more stable emotional baseline. In simple terms, neurofeedback helps your brain become less reactive and more flexible. When you combine DBT and neurofeedback, it all comes together. Think of neurofeedback as strengthening your brain's ability to stay calm and regulated. And think of DBT as teaching you what to do with that calm once you have it. For example, you might learn a DBT skill like grounding or breathing, but if your nervous system is already overwhelmed, it can be hard to access that skill in the moment. Neurofeedback helps lower that baseline intensity, so when something stressful happens, you're not starting at a 10. You might be starting at a 5, which makes it much easier to use the skills you've learned. At the same time, as you practice DBT skills in your daily life, using mindfulness to pause and notice your emotions without reacting, applying those strategies during stressful moments, or choosing more effective ways to communicate in relationships, you can reinforce the changes your brain is making during neurofeedback. It becomes a powerful cycle. Your brain becomes more regulated. You use your skills more efficiently, and both continue to strengthen each other over time. When these two applications are combined, many people experience feeling calmer and more in control of their emotions, being able to respond instead of react. They'll have less impulsivity, fewer emotional spikes, greater confidence in handling difficult emotions. Long-term changes, not just coping, but growth will occur. This approach works on both levels, helping you build skills while reshaping how your brain responds to stress. If you felt stuck in patterns of emotional overwhelm, it doesn't mean you're failing. It means your system needs support in a different way. You're not just managing emotions. When you combine, you're training your brain and building skills that create lasting change. And with the right tools and support, emotional balance is absolutely within reach. Train your brain, learn the skills, take back emotional control. We would be happy to help you learn emotional regulation.